Hey guys, Dr. McCoy here at Drummond Chiropractic. I wanted to review some success stories that we've had here at the clinic. The first one I want to talk about is a construction worker. He came in presenting with neck pain, unable to turn to operate his heavy machinery, and numbness in his hands that made it hard to work different controls. And then over about a 3-week period, 6 visits or so, he was able to return full range of motion and then had no numbness in his hands for the first time in about his 10-year career that he could remember. And he was able to go on, have work longer, harder days without having that pain when he got home, that he wasn't able to play with his kids when he got home, or he didn't want to help out around the house just because he was in so much pain. So we really helped him get back and increase those things at home that you just kind of take for granted that you can't do. And it's always great to see when patients get that back in there and they're excited that they can do those things again that we just take for granted when pain comes and it knocks you out of those activities. The next one is a CrossCountry athlete that I had a strain in his hip flexor. Doing some ART, some muscle work, backing that up with some everyday mobility stretches and strengthening around his hips, he was able to return to play in about 3 weeks when his trainers at school and his MD was counting him out for the rest of the season, and we were able to get him in there towards the end of the season, and he was able to complete it. Just seeing the joy on his face when he was able to get back out there, I know it was really keeping him down that he couldn't be out there with his other teammates out there practicing and trying to win a tournament for the team. So that was a big win for us here at the office. The next one was a grandma, and she had some lower back pain and was not able to get up and off the ground. Mainly she was watching her grandkids, and it was really hard for her not to be able to get down on the ground and play with them every day. And then through some using our tables here that we have with flexion distraction, I'm doing some drops to help mobilize the joints, and then showing her some exercises, she was able in about 2 weeks or so, in just 3 or 4 visits, she was able to get back to being able to babysit her grandkids and playing with them, no problems, not worrying about that she was gonna have to ice because she was just playing with her grandkids. And she was very excited and helpful, and we were very grateful to be able to give that to her as well. The fourth one is a football athlete that I had here towards the end of the fall, and he was younger, still growing, and he was having some heel pain when he was running and walking and then could barely walk after practice. And what's happened sometimes in younger athletes is their growth plate in their heel is still expanding so their foot can grow, and it starts to kind of almost split and agitate even more because how active they are. So we got him in some specific orthotics for younger athletes from foot levelers, and then I added in some stability work in his hips and in his ankles to help him get back. And he was only out of practice for maybe a week. And once he got used to orthotics and kept up with his stability exercises, he was out back playing within 1 or 2 visits. And then we did a couple follow-up to make sure he maintained, but he was back within a week, back to return to play. And you can just tell, especially with athletes, that's my background, that's what got me into chiropractic, and seeing an athlete being able to get back on the field, I know how big it is to them mentally to be able to be out there and be with their teammates and everything like that. So I never take that one for granted. My last one was a cheerleader athlete, and she had some constant pain, and it was a little bit more difficult of a case. A couple visits she was feeling better, but it was always come back. And then after the 4th or 5th visit, I got her in an SI belt, which helps kind of stabilize the SI. Due to the tumbling and different things that cheerleaders do, they become really hyper flexible. So we weren't adjusting her lower back. We were doing more stability work, strengthening the muscles, her core, to help stabilize the area so it was stronger, so she could do the tumbling and the flips, so she could compete. And then we also backed that up with some dry needling, and more in the hips, not in the lower back. And that helped relieve the tension and the pain control, which really helped her be able to get back to play. It took her about a month or so to get back in there, but then she was able to get back in for the last competition of the year. And she was very grateful when she came back in here, and we were ecstatic that we could give her to that as well. It's always exciting for us when you come in here and you tell us you're able to do something and that we were able to provide that care for you. So if you have any of these problems, or if you have anything that's keeping you from living your life and not being able to do an activity, we can take care of you here at Drummond Chiropractic.